Well, my view of the outbreak of the Wu flu, or the UWU flu, or the Wuhan coronavirus, as boring people call it, is beginning to take shape. I've been pretty hesitant to make any definitive statements. That's why I've only done a couple videos on it, because, frankly, I'm not an epidemiologist. I tend to think that these sorts of things get overblown because, well, I shouldn't say that. I think that people are, most of the time when it comes to these outbreaks of new diseases, people are appropriately nervous. It's not irrational to show a great bit of fear when it comes to something new and unknown, to where we don't know the capabilities of, in this case, a virus. But most of the time, it works out that these things are not a very big deal. I've cited before the example of Ebola. I was, somewhat worried about the whole Ebola thing, but not too much. I was, concerned because it is a very terrible disease. I had already, before the Ebola thing took off and there was any kind of Ebola outbreak, I had read a book on Ebola, a few years before that had really spooked me. And I thought, boy, I'm sure glad that Ebola, there's never been a major Ebola outbreak, but then all of a sudden there kind of was. But then, that particular disease didn't spread too easily, so there really wasn't much concern over the idea that the whole world was going to die of Ebola or something like that. You take some basic precautions, wash your hands, don't cough on people, don't let other people cough on you, and don't lick other people's spit and stuff like that, and you won't catch Ebola. But with the Wu flu, it seems like that's not the case. As I was saying earlier, it seems like this is far more contagious, and that we're finding out, and it's being confirmed more and more as we get more cases popping up, that yes, this is being spread human to human. This is not coming from bat soup. So it's not like, okay, just don't eat the bat soup and nobody's going to get the Wu flu. This is being spread between different human beings, and it's being spread when people are asymptomatic. There are, because certain folks have a little better immunity, and this is not necessarily the worst disease in the world if you're not immunocompromised or old or young, basically, which is the case with most disease. And so if you're someone with a decent immune system, you may not necessarily even feel very sick, but you can spread this to older people or to young people and end up killing them. And so that's why people really should be scared of this, because we don't know who has this. We definitely know that the cases are being way underestimated because, like I said, unless you get sick, you're not going to go get tested and even find out if you have it. And so there are people now walking all around, mostly in China, who have this disease and are spreading it to other people, but don't, even realize they're doing it. And so, of course, some of those people, by this point, have made it to the United States. We have a few confirmed cases here in the U.S. We don't know who all those people infected. We don't know of those people who are infected, in the U.S., human to human, who of those folks are even showing symptoms. And, the odds are that, considering that, I guess, the way that, from what we understand, there is a significant portion of people who are doing very well at fighting this virus off, in other words, are not going to go to the hospital and be quarantined, so they will just keep spreading it around. And so I really see no real way to contain this. I mean, I think Zero Hedge was the one that had the tweet yesterday that the cases of this disease are up something like 1,200% over the past week. And Chris Martenson decided, who is of peakprosperity.com, he's been following this, doing daily updates on this, and this is really his wheelhouse. So I think he's probably a good guy to watch for this. I've been a subscriber to Chris Martenson for many years. He's all into this kind of stuff, infectious disease, all the bees are dying off, what's killing the bees, that kind of thing. And he decided to take the data that we have, which, by the way, is being manipulated by the media. Imagine that. They are manipulating the data we have on the coronavirus cases and putting it up against SARS and saying, oh, look, so far, as of 2 days ago, now of today, there'll probably be more cases of Wu flu than there were of SARS. But 2 days ago, there were only like 6,000 Wu flu cases, and they put that up against SARS, which had like 8,500, and they said, oh, look, there were more cases of Wu flu, or there were more cases of SARS than Wu flu, and there were so many more deaths from SARS than Wu flu. And the reason why that's so misleading to the public, and why the media is clearly trying to suppress worry over this outbreak, is that that's time series data. The series for the SARS data they were using ran from like November 2002 to July of 2003, whereas the data for the WU flu only is from pretty much this month. And so in order to get an accurate picture, you would actually have to put these things on a dot chart, or a dot plot, or a line graph, whatever you want to call it. But basically something, a graph that's more suited to time series data. And if you look at it that way, well, then the WU flu looks really, really scary. Because it took really quite a few months after the start of the SARS outbreak for many people to start actually coming down with it. And, of course, there are a lot more deaths from SARS so far because, SARS, the outbreak is over and done with. So everyone who had it and was going to die has already died. There are a lot of people alive right now with the WU flu who are not going to make it. And again, if we look at the numbers of people who have died from the WU flu so far versus those who have actually recovered, so meaning the people who don't have the disease anymore, the people who, the virus has run its course, the numbers who have succumbed to that versus those who have overcome it, are not looking good. It's 170 dead versus 133 recovered. So it looks to me like you're having more people dying still than are recovering. And again, this is out of the people who are, at least sick enough to warrant being tested and tested positive. Like I said, there's many more times folks, from what we understand, who should be carrying this disease and aren't necessarily presenting symptoms. But out of the folks who got sick, who actually, are feeling some not so great symptoms from this virus, most of them are dying. Oh, and to get back to the data that Martinson was going over, he also took the liberty of putting the data through into a log linear graph, which of course it mathematically reduces the power of the data. So meaning that if you have a data set that can be graphed with like a quartic equation, it would be reduced to a cubic equation. If you have something that can be graphed with a quadratic, it would be reduced to linear. And so he put the data through this equation, and it came out to almost a straight line, meaning that the growth in the cases of this virus at this point are exponential. And so it's going to keep increasing more and more every day. We're going to have more and more cases. This is not slowing down. This is not a constant rate of increase. This is an accelerating rate of increase. And so he then extrapolated based on that. Well, if this trend continues, where are we going to be in a month? Well, in a month, there were about 115 million cases by his math. Now, are the odds then that this trend continues? I don't know necessarily. You could say, okay, well maybe the Chinese are good at containing it, and then they're able to quarantine all of China and stop the spread of it in there. Well, the virus is already outside of China, and that's your big problem, is that pretty much nowhere else on Earth are they going to be able to take the draconian measures that China has in closing a city of 11 million people, lots of other big cities, completely sealed off from the outside world. They're taking people who, there might be one guy in an apartment building who's suspected of having the WU flu, and they'll barricade the entire building. They will bolt the doors shut. These sorts of measures aren't really going to fly outside of China. And now, with the first confirmed case of the WU flu in India, we should be especially concerned, since India is kind of the polar opposite of China in that respect. Of course, China is not necessarily the cleanest place on Earth. They're not Singapore. But in India, they have very poor sanitation, and you have very high population density throughout much of the country. Now, I don't know necessarily if it could be that this case came from somebody who was in some small remote village in India that doesn't come into contact with a lot of people. But if you had an outbreak of this, if you had one person essentially who went into a major Indian city like New Delhi and was just walking through a market, there's no telling how many thousands of people would already be infected because of that. And of course, once the outbreak starts there's going to be no way to contain it in India. And that'll, and you can say, okay, well, that's India. I don't live in India. Well, India has, like China, but if you put India and China together, that's a bulk of the world's population. And so if you have the Wu flu running around unabated, well, then this is going to put a major dent in the population of those two countries. Of course, it'd have to really tear through them to really make any sizable impact, since there are literally billions of people in those two countries. But do you really think that if you have a virus that is, wreaking havoc in India and China, that it will not also wreak havoc in the rest of the world? You have a lot of Chinese and Indian people all around the world, just because there are so many Chinese and Indians. You have lots of other people from around the world who are going throughout China and India themselves. There's so much international travel going on now. I mean, even if you wanted to seal them off right now, the contagion is probably already spread. You could slow it down a little, maybe. But I think that it's inevitable that if this thing really is as contagious as it seems, it's going to end up just about everywhere. And so while it might not make a big dent in the population of a large country like China or India, it could do quite the number on smaller countries, particularly countries with inverted population pyramids, like you have in a lot of the developed world, to where your population is largely very old and weak. Well, this could cull a lot of those people. And this, is all assuming that the Chinese data is correct and that they're telling us the total unvarnished truth. Of course, the fact of the matter is that the Chinese government, knowing them, are likely lying to a great extent. We probably don't know nearly how many cases there are or how many people have died. There are, of course, lots of rumors going on about the Chinese running these crematoriums, burning off all sorts of bodies and trying to hide the evidence so that the casualty count isn't as high. I don't know if any of that's true. These are just rumors. But, something that seems to have a bit more credence, as far as I'm concerned, is this idea that the Wu flu actually originated from this bioweapons research lab that exists in Wuhan. Because there's been a lot of news that looks very suspicious, as far as some Chinese researchers stealing some coronavirus samples from Canada and taking them back to Wuhan, and the chairman of the Department of Chemistry at Harvard University being, I guess, charged as a spy for China, and helping facilitate biological samples being sent to Wuhan. The possibility that this perhaps was an engineered virus, a GMO, essentially, a genetically modified organism, specifically designed to kill people, that was accidentally released into the surrounding city, seems to be pretty plausible. And if that's the case, well, then we can definitely assume that this thing is going to be absurdly lethal and hard to treat. Otherwise, why specially engineer a virus that you plan to use as a weapon? You want it to be as effective as possible. But the good news, as far as that's concerned, is that if the Chinese did create this virus, I would imagine they also created some sort of vaccine. But then again, if they don't have a vaccine, or if they do have a vaccine, why haven't they brought it out yet? Would it just be too obvious then that this was a bioweapon if they immediately came out with a vaccine for it? I don't know. And frankly, I think any more speculation at this point is going to be counterproductive. I want to limit this to mostly what we know for a fact, or at least mostly what we're being told, which of course is oftentimes going to be disinformation. The last couple days, the media seems to be in full spin mode, trying to, reassure people, hey, it's not that bad. And there's been a lot of propaganda coming out of China that's been regurgitated by the Western media about how, oh my gosh, the Chinese, they're doing so much to try and combat this, and they're so unified. And you have that clip that keeps going around of the people in Wuhan chanting, happy slogans. While at the same time, we're still getting leaks of videos like a man in Shanghai on the train who was just, sort of leaned over, throwing up blood, and there was, blood spattered all over the train floor, and, terribly gruesome scene. And so all in all, it looks like things are going to get much worse from here on out as far as the Wu flu is concerned. And so while I don't plan to make this the focus of my channel, because there are plenty of other people, Chris Martenson, I think, first chief among them, who's doing a very good job at covering all this, I will be chiming in from time to time with my thoughts on, how things are stirring up. So if things continue to get very bad, I probably will have some more words over the weekend. And so with that said, if you gained anything of value out of this video, I'd appreciate you clicking that like button and sharing this video. If you haven't already, please do subscribe, because I do upload every day and I'd hate to have you miss one. So I'll see you folks back here tomorrow.